Hello, I'm Dr. David Petters, and I've been on the Technique Department here at Northeast College of Health Sciences for 28 years. And today I'd like to introduce and demonstrate a bit of the primary chiropractic adjustment technique that we teach here at Northeast, and that's Diversified technique. Diversified technique is a method of applying short, quick hand movements to joints to improve and restore their range of motion. At Northeast, our emphasis in the assessment and treatment of musculoskeletal disorders is on function. Proper balanced function of the locomotor system, that is, the joints of the spine and extremities and their associated muscles and fascia, is essential for full pain-free movement and function throughout the body, and as well as for overall health. Of course, it's important that we learn and become skilled at adjusting all regions of the spine. So that would include broadly the cervical and the thoracic and the lumbopelvic region. By doing a chiropractic adjustment, the goal is to restore range of motion of a joint. One of the most important tools that we have whereby we determine whether or not a patient needs an adjustment, we call motion palpation. So that, in other words, that's sensing with my hands whether there's full motion in a joint. You know, there are a lot of nerve fibers in the joint and all around the musculature. And if a joint isn't participating in motion, it kind of produces sort of a static in the nervous system. So your nervous system, it has to kind of deal with what it's receiving from its nerves. And if that joint isn't moving properly, we can get an imbalance in muscle tension and even a spillover into other parts of the nervous system, which could affect overall health. So anytime we find a joint which is not moving properly and not participating in motion as much as it should, we would like to increase that range of motion of the joint through an adjustment. So in Bridget's case here, I found that there's some restriction on the left side of her neck towards the upper part. And the adjustment is, as I mentioned in the description of what diversified technique is, it's actually using my hand to contact the joint and then to move my hand quickly and through a short range to actually go past that movement barrier and release the joint so that it moves better. So let's demonstrate that. So here, take a contact. So I'm contacting with this part of my finger, right? And then I like to stand up for this. So we'll come over to the side. All right, so okay if I adjust that? Good. There. And then from here, I'm going to take a little bit there and just a little thrust like that. So the joints gap a very small amount, right? Sometimes there's a sound associated with it, as we heard on this. I don't know if you picked that up or not, but that small amount of motion, that gapping, releases the restriction, and then we should have better range of motion of that joint, and it feels a bit more balanced now.